Good day everyone. Today, we will be discussing the different projections of the vertebral column. The first projection is the AP projection Fox method dense. First, place the patient in supine position and extend the chin and mastoid process until they form vertical. And use 8x10 image receptor and center the image receptor at the tip of the chin. And the central ray must be perpendicular to the image receptor at distal tip of the chin. The structure shown in this projection is the dens of axis lying on the circular foramen magnum. And now, we will going to discuss the different projections of the atlas and axis. The first projection is the AD projection open mouth. First, place the patient in supine position with an open mouth. And use 8x10 image receptor and center the image receptor at the axis. The central ray must be perpendicular to the image receptor and in the midpoint of the mouth. The structure shown in this projection is the atlas and axis in an open mouth. And now, we will be discussing the different projection of the cervical vertebrae. The first projection is the lateral projection Grande method. First, place the patient in lateral upright and the shoulder rotated anteriorly and posteriorly while the chin is slightly elevated. And use 8x10 image receptor and center the image receptor at the level of the C4. And the central ray must be horizontally and perpendicularly directed at the level of the C4. The structure shown in this projection is the lateral cervical bone and interspaces and the lower 5 zygapophyseal joint. The second projection of the cervical vertebrae is the lateral projection, hyperflexion and hyperextension. First, place the patient in lateral upright and use 10x12 image receptor and center the image receptor at the level of the C4. And draw the chin down and close to the chest. The central ray must be perpendicularly directed to the level of the C4. The structure shown in this projection is the spinous process is elevated and widely separated, and all the 7 spinous process and all the 7 cervical vertebrae introlateral. And next is the hyperextension. Elevate the chin as much as possible. And the central ray must be perpendicularly directed at the level of the C4. The structure shown in this projection is depressed in close approximation and all the 7 cervical vertebrae introlateral. And now, we will be discussing different projections of the cervical intervertebral foramina. The first projection is the AP axial oblique projection. First, place the patient in supine and in upright position. In this case, the patient is in upright position. And rotate the body by 45 degrees in an affected side. And use 8x10 image receptor and center the image receptor at the level of the CP. And the central ray must be 15 to 20 degrees cephalad at the level of the C4. The structure shown in this projection is the intervertebral foramina, and the pedicle is farthest from the image receptor. In the second projection of the cervical intervertebral foramina is the PA axial oblique projection. First, place the patient in supine or in standing position. In this case, the patient's standing position. Use 8x10 image receptor and rotate the body by 45 degrees on the affected side. And center the image receptor at the level of the C3. And the central ray must be 15 to 20 degrees caudal at the level of the C4. The structure shown in this projection is the intervertebral foramina, and the pedicle is closest to the image receptor. And now, we will be going to discuss the different projections of the thoracic vertebra. The first projection is the AP projection. First, place the patient in supine position with the hip flexed to reduce kyphosis, and the thighs face vertical. And use 14x17 image receptor and center the image receptor at the level of T7. And the central ray must be perpendicularly directed to the image receptor between the jugular notch and the xiphoid process. And the structure shown in this projection is a 12 thoracic vertebrae. The second projection of the thoracic vertebra is the lateral projection, right and left position. First, place the patient in left lateral recumbent. As much as possible, left, to place the heart closest to the cassette and to minimize overlapping of the heart and the vertebrae. And use 14x17 image receptor and center the image receptor at the level of the T7. And the central ray must be perpendicularly directed at the level of T7. For male, 15 degrees cephalad at the level of T7. For female, 10 degrees cephalad at the level of the T7. The structure shown in this projection is the interspaces of thoracic vertebra and the intervertebral foramina. The third projection is the AP oblique projection, zygapophyseal joint. First, place the patient in supine or in upright position. In this case, the patient is in upright position. Rotate the body by 20 degrees posteriorly to form an angle of 70 degrees to the coronal plane. And use 14x17 image receptor and center the image receptor at the level of the T7. The central ray must be perpendicularly directed at the level of the T7. The structure shown in this projection is the zygapophyseal joint is farthest from the image receptor. The fourth projection is the PA oblique projection, zygapophyseal joint. First, place the patient in supine or in upright position. In this case, the patient is in upright position. Rotate the body by 20 degrees anteriorly to form an angle of 70 degrees in the coronal plane. And use 14/17 image receptor and center the image receptor at the level of the T7. The central ray must be perpendicularly directed at the level of the T7. The structure shown in this projection is the zygapophyseal joint is closest to the image receptor. And now, we will be going to discuss a different projection of the lumbar vertebrae. The first projection is the AP projection. First, place the patient in supine position on the radiographic table. When the patient knees flex, the lordotic curve decreases, and when the patient knees extended, the lordotic curves increases. In this case, the patient is in flex. The knee of the patient is flex. And use 11/14 image receptor and place the image receptor at the center of the iliac crest. And the central ray must be perpendicularly directed to the iliac crest at the level of the T4. The structure shown in this projection is the distortion of body and poor delineation of the intervertebral disc spaces. The second projection is the lateral projection. Place the patient in lateral recumbent. In this case, the patient is in left lateral recumbent. And use 11/14 image receptor and center the image receptor at the level of the iliac crest. And the central ray must be perpendicularly directed at the level of the iliac crest. For male, the central ray must be 5-degree caudate at the iliac crest. For female, 8-degree caudate at the level of the iliac crest. The structure shown in this projection is the lumbosacral joint junction and the intervertebral foramina from L1 to L4. The third projection is the AP oblique projection, zygapophyseal joint. First, place the patient in supine position. Rotate the body by 45 degrees closest to the image receptor. In this case, the patient is in left posterior oblique. And use 11/14 image receptor and center the image receptor at the level of the axis. The central ray must be 2-inch medial to the axis and 1/2 above iliac crest. The structure shown in this projection is the articular process closest to the image receptor and the left zygapophyseal joint. The third projection is the PA oblique projection, zygapophyseal joint. First, place the patient in prone position and rotate the body by 45 degrees. In this case, the patient is in right anterior oblique. Use 11/14 image receptor and center the image receptor at the level of the iliac crest. The central ray must be perpendicular to the L3 above iliac crest. structure shown in this projection is the articular process farthest from the IR and the left zygapophyseal joint. The fifth projection is the AP projection, right and left bending. First, place the patient in supine position and use 11/14 image receptor and place the image receptor at the level of the iliac crest. Make the first radiograph in right bending. Kailangan pa rin mag-close fit para ma-maintain yung bending ng katawan. The central ray must be perpendicularly directed at the level of the L3, 1 to 1.5 inch above iliac crest. And make the second radiograph in left maximum bending. The central ray must be perpendicularly directed at the level of the L3, 1 to 1.5 inch above iliac crest. The structure shown in this projection is the lumbar vertebrae with maximum right and left bending. And this projection used to detect early stage of scoliosis and their structural change. For the last projection, lateral projection, hyperflexion, and hyperextension. First, place the patient in upright and in lateral. And use 14/17 image receptor. For the first radiograph, bend the patient forward to flex the spine as much as possible. And place the image receptor to the spinal fusion. The central ray must be perpendicularly directed at the level of the L3 or in the spinal fusion. For the second radiograph, bend the patient backward to extend the spine as much as possible. The central ray must be perpendicularly directed at the level of the spinal fusion or L3. The structure shown in this projection is to localize herniated disc shown by limitation of motion at the site of lesion.